Scoliosis is a three-dimensional problem. The spine will curve to the side while also rotating. To fix a scoliosis, the spine must be straightened and derotated. In today's video, we will talk about how the spine can get stiff and stuck in a scoliosis curve, what causes the spine to get stiff, how doctors determine how stiff the spine is, how stiffness affects bracing and scoliosis treatment, how surgeons deal with stiffness, how stiffness can be effectively treated without surgery using the Scoliosis Flexibility Trainer, and finally, how addressing stiffness without surgery improves bracing, scoliosis treatment, and success. What are contractures? Contractures are changes or stiffening of connective tissue such as ligaments, tendons, and muscles that result in the loss of motion of a joint. A spine with scoliosis will develop contractures over time. On the convex side of the scoliosis curve, the tissue will grow abnormally longer, while on the concave side, the tissue will grow shorter. These stiff tissues, as well as the rotation, limit how much the spine can be straightened. But just how stiff is the spine? Before surgery, it's routine to determine how stiff the spine is. This is determined by X-ray. Here we have a scoliosis X-ray with two curves, a left curve and a right curve. An X-ray is taken with the person bending to the right. Bending right should reduce or open up the right curve, but notice how the curve is still there even when bending. This happens because of two reasons. Contractures limit movement due to the stiff connective tissue. Meanwhile, the rotation of the spine prevents a normal side-to-side movement. Also notice how the left curve has become even worse when bending to the right. Trying to help one curve causes the other to get worse. When the person bends to the left, notice how the left curve is still stuck, bending to the right, even though the body is bent to the left. Again, notice how even though our left curve has reduced, our right curve is now even worse. Once again, treating one curve worsens the other. So how does a stiff spine affect bracing? How straight the brace can make the spine is limited by contractures and rotation. This also limits how successful treatment can be. Here we have two X-rays of the same spine, one before the brace and one while they're wearing it. Notice how because of contracture and rotation, the spine still cannot be fully straightened even by the brace. Even worse, 5 months after this image was taken, we can see that the curve has actually gotten worse than it was to begin with. So how do we solve the problem of rotation and contractures? Surgeons treat contractures the only way they know how, with surgery. Contractures are cut out, destroying joints of the spine, which are then fused. This process is known as release. But what if contractures and rotation could be treated without surgery? When contractures happen in other joints like the elbow or knee, they're treated by physical therapists by targeted, prolonged stretching. But a device for stretching contractures in the spine didn't exist until we created one. The Scoliosis Flexibility Trainer solves both the problem of contracture and rotation. The spine is derotated while also increasing range of motion, stretching the stiff, soft tissue. Let's look at an example of the Scoliosis Flexibility Trainer in action. Notice how the curve has been effectively reversed, stretching contracture and restoring range of motion. This non-surgical release of contractures and derotation of the spine allow the spine to be straightened much more by the brace. Let's look at our same spine as before, in and out of brace, but this time, after treating it with the Scoliosis Flexibility Trainer. We can see that in the Flexibility Trainer, the curve is significantly reduced, derotating the spine while also releasing contractures. Now when we use a brace, notice how much more our curve is reduced. Our top curve has been reduced from 48 down to 13 degrees after restoring range of motion with the Scoliosis Flexibility Trainer. Notice and compare how straight the spine is in each brace. On the left is our original brace, while on the right is a new brace which is able to straighten the spine more due to its newly increased range of motion. Notice how we're now able to straighten the spine by an additional 13 degrees in the brace, thanks to derotating the spine and releasing contractures. Now let's see what happens over time. 6 months after the new brace, our curve hasn't gotten any worse, and instead is actually slightly smaller than it was to begin with. Fast forward an additional 14 months, and our curve is significantly reduced out of the brace, over 20 degrees less than where we first started. Continued use of the Scoliosis Flexibility Trainer continues to restore range of motion to the spine, which allows the brace to be continually improved as well, helping to straighten the spine more over time. Let's look at a few more examples of the Scoliosis Flexibility Trainer in action and see how much range of motion it can restore. In each example, notice how the spine is derotated and the curve is reduced or reversed, providing an effective stretch. The Scoliosis Flexibility Trainer stretches contractures while also derotating the spine. By doing this, the soft tissue is safely stretched, treating any contractures that may be keeping the spine stiff. This restores range of motion to the spine while also allowing it to be better straightened when the brace is worn. You can learn more about the Scoliosis Flexibility Trainer, as well as the comprehensive treatment program it's part of, at scoliosiscarecenters.com.